Hi everyone, my name is Corey Johnson. I work on the social media team here at Children's Hospital of Wisconsin. Thank you so much for joining us. Today we're going to talk about head lice. I know a lot of parents have questions about head lice, and I'm joined by Dr. Michael O'Reilly from Mayfair Pediatrics. So if you have questions about head lice, please feel free to go ahead and post them in the comment section of this video, and we'll try to get to those questions towards the end of this broadcast. Today we'd like to cover topics like what are head lice, what do they look like, how do you identify them, and how do you treat them. And you may have seen some stories in the news recently about these things called super lice. So with that, I'd like to go ahead and introduce you to Dr. Michael O'Reilly.
Hello.
Could you tell us a little bit about yourself? Where do you work and what types of patients do you see?
Sure. I work at Mayfair Pediatrics, which is on OReilly Road in Wauwatosa, and I generally see kids from birth up until about 18, 19 years old.
All right, so let's just jump right in it. Let's talk about head lice. What exactly are head lice?
Sure. So head lice are little bugs that live in, where they cause problems is when they live in people's hair, and they kind of bite the skin, they feed on the blood, they lay eggs, and they're really itchy and kind of uncomfortable and pretty contagious as well.
And as a pediatrician, do you see a lot of parents with questions about head lice? Is this a common thing?
We see a lot, yeah. A lot of times people are able to kind of deal with it at home and take care of it, but sometimes we get calls about it, asking questions.
Okay. And I've seen some stories right now in the news about these things called super lice. What are the difference between super lice and head lice?
Sure. So actually they're basically the same thing. They're still the bugs that feed on blood from the scalp. So the super lice are called that because they're resistant to some of the medicines that we generally use, the over-the-counter medicines we generally use to treat typical head lice. So they call them super lice just because they're a little bit harder to get rid of.
Okay. Now, if your child has head lice, is that a dangerous thing? Is it a problem?
No, it's not. It's itchy and it's uncomfortable, but it's generally not a problem. No one's ever died or gone to the hospital for lice. It just happens and it's annoying.
Yeah, really annoying.
Yeah.
So if you're a parent and you're concerned about this, what are you looking for in your child's hair to identify these head lice?
So basically you just want to go through with like a good comb and just really look for, you can sometimes see the lice, which are just little bugs you see in there. There's not too many other bugs that you would see in the hair generally. And then sometimes you can see what's called the nits or the eggs, which are little white dots. They're sometimes actually hard to see, but they're kind of usually closer to the root of the hair.
So there could be bugs in my child's hair that are leaving eggs, right?
Yep.
And so the eggs are called nits, right? And the lice, if the lice jump off my child's head, do the lice like start living in my carpet or my couch at home, or?
No, they usually die pretty quickly. They don't survive for too long when they don't have any kind of blood to feed on, but they can live in other people's hair or the family pet or something like that. So.
Well, that's a great question. I think, how do lice typically spread from child to child?
Usually just close contact, or they can kind of move around, sharing hats sometimes, sharing combs, sharing brushes. So that's all stuff you want to avoid for sure.
And how long typically do those eggs stay on your child's head before they hatch into lice?
That's a good question. I think it's usually a few weeks, but
yeah. So I mean, you have some time there where you have eggs on your child's head before they actually hatch and turn into lice.
Right.
So how can parents treat this, or what should they do? What's the first thing you should do if you think your child has head lice?
So basically, the first thing you can always do, you look through the hair. You can go through with like a fine comb too to see if you can get some of those bugs and lice out and get rid of them. Okay. But then if it looks like head lice, the best thing to do is go to the store, go to the drugstore, look for the over-the-counter head lice products. Usually it has a product called like permethrin in it, and then take that and use it on the child's hair.
If I see lice on my child's head, should I call my pediatrician right away, or should I first do the over-the-counter thing?
Not necessarily. I would try. If it looks like lice, it probably is lice, and it usually responds really well to the over-the-counter treatment. So it's generally fine to just go and try the over-the-counter stuff, follow the directions. Usually you have to use it a couple times, but that generally clears up most lice, and there's no problems after that.
What if I have a couple kids at home? I mean, should all of my children go through the same process that the one child who has the lice, or?
Not necessarily. I would check the other kids really carefully and be close, like be really good about checking them and pretty frequently, but they don't necessarily have to.
Okay. Let's say that doesn't help, or then what would you do if I called the pediatrician and I explained that I bought an over-the-counter medication and it's not working?
So you definitely make sure you're using it correctly, because there are certain ways you have to use it. But if it's been used correctly and it's still not going away, then those might be those so-called super lice. And then at that time we could do an over-the-counter product, which are usually another type of topical medication, things you can put in the hair.
Now those prescription then, or?
Yeah, they would be prescription.
Okay. Do you have any just general advice for parents about head lice? Maybe how to prevent them, or tips that they could maybe give their kids to avoid this?
There's basically the tips are just the same thing, kind of like not sharing hats, not sharing brushes, not sharing combs. They do check it at school often, I think, so it's sometimes they catch it there when the school check, but it's not something a kid has to be sent home from school for. They can kind of finish out the day and then do the treatment that night and go back to school the next day.
And is there an easy way to know when you're successful? Because if these eggs can stay on my child's head for a week or two, how do I know when it's gone?
Just keep checking. I mean, you want to be diligent with checks, but they should, if you treated it successfully and you're combing everything out, it should be able to go away pretty quickly.
Okay. Like I said, are there any other final thoughts or kind of final recommendations you have for parents who might be worried about head lice?
I just think it's not it's annoying and it's itchy, but it's not something to worry too much about. Again, it's not very dangerous. It's not a serious health concern. It's just itchy and uncomfortable, but they're generally pretty easy to get rid of. Even the super lice, the products we use can generally get rid of them pretty well.
Oh, great.
We have a couple of great questions here. Is it true that tea tree oil or coconut oil or other home remedies work or help to prevent lice from spreading?
I've heard that before. I don't know if it's true. I don't know if it's been studied per se. It's probably not going to hurt too bad, but sometimes you can put those oils in to kind of moisturize the hair, and then that sometimes works better to kind of comb the hair out afterwards after it's been moisturized a little bit, but I don't think it's necessarily dangerous. I just don't know if it's going to work entirely well.
Also, is there a season when lice are more prevalent, when you should really be watching out for them more?
Actually, I'm not sure. I think they happen, generally when kids are in school, so they're kind of all around, but I'm not sure if there's a specific season about that.
Okay, great.
All right, well, Dr. OReilly, thank you so much for taking time today to talk about head lice. And again, I think if you have questions about this, your pediatrician would be a good resource,
Excellent.
Right?
Yep, definitely.
Right. Well, thanks everybody for joining us today. Tune in next time. Thank you.
Thank you.